Hey, welcome back to A World Without Malaria. My name's Chris. In Chapter 11, we looked a little at malaria and the unborn child. But in this chapter, we're going to look at malaria in children. We at BuzzOff believe that every individual is precious, and children particularly should be treated with love and tenderness. As you watch this video, I'm sure that you'll learn things that will really empower you to effectively save children from the effects of malaria. Enjoy.
Hello, my name is Florence. Children under 5 years of age are one of the most vulnerable groups affected by malaria. You may be interested to know that in recent years, according to the World Health Organization, approximately 76% of malarial deaths are children under 5. Can you imagine? That is almost 500,000 children dying each year because of a preventable and treatable disease. And this is a very shocking statistic. We know that infants and children are much smaller than adults, and so the amount of blood in their bodies is significantly less. Therefore, we understand that a child has significantly fewer red blood cells than adults. Now, because children have fewer red blood cells for the malaria parasites to destroy, they quickly become very ill. And death can occur within 24 hours in children, and therefore it is critical to have them tested and treated as soon as malaria is suspected. Recognizing the signs and symptoms of malaria in children under 5 years is important and can be difficult because they often present differently to adults. For an overview on the signs and symptoms of malaria, be sure to watch Chapter 4. Children will often have high fever, which can come in cycles. This is when a very high temperature occurs for a period of time, followed by a normal temperature for a while, and then back to a high temperature. In a small child under 5 years, you may not always see fever coming in cycles. A very high temperature can cause convulsions in anyone, but convulsions are much more likely to occur in children under 5 years. Now, a child with malaria may be generally irritable and crying, and the malaria-infected child will probably have a poor appetite and may have vomiting and stomach pain. Now, another problem for children with malaria is dehydration. Dehydration is when there is not enough fluid in the body. Dehydration is something to be looking for, as this condition will occur quickly in a child that is not drinking enough fluid. Okay, let's look a little closer at the signs of dehydration, as when this condition is not recognized, it will quickly lead to death in children, but it normally can easily be treated. A person becoming dehydrated will feel thirsty, and if no fluid is given, they will start to lose the elasticity in the skin. In the picture, you can see a person gently pinching the skin, and when they let go instead of immediately sliding back into place, the skin stays raised. Another sign is that the child's eyes will become sunken and tearless. Also, little or no urine will be passed, and any that is will be a dark orange color. When a baby is dehydrated, the fontanelle or soft spot at the front of the skull will be sunken in. Signs and symptoms of malaria in children over 5 years can be a little different to those under 5 years because, as well as the symptoms just mentioned, the older child may complain of flu-like conditions such as feeling generally unwell or body aches and a running nose. Headaches may be another complaint. Anemia is extremely common in children with malaria, so be sure to look for the signs of anemia, such as tiredness, pale skin and gums. Check out Chapter 5 for more info on anemia. In young children, malaria progresses quickly. Anemia and paleness can begin within a day or two. The palms may show a blue-gray color, and breathing may be rapid and deep. Cerebral malaria, that is malaria affecting the brain, causes fits and unconsciousness and can also develop very quickly in children. Another complication is when the blood sugar levels are too low. This is called hypoglycemia. If this occurs, the child will become disoriented and fall into a coma, and if not treated, will die. It goes without saying that prompt treatment and management of malaria in children is essential. Early diagnosis is vital and is done by using a rapid diagnostic test kit, RDT, or looking at a blood sample under a microscope as described in Chapter 10. If the result is positive, seek medical help as soon as possible, as it is important to give the correct anti-malarial medication as soon as possible. And please, be sure to give fluids to prevent dehydration, orally if possible. And at the back of your handbook, in the recipe section, is a simple life-saving fluid that you can make and give to someone with dehydration. It is called Oral Rehydration Solution, ORS. You need 6 level teaspoons of sugar, a half level teaspoon of salt, and 1 liter of water. Making this correctly and using the correct measurements will provide you with a quick way to assist in rehydration. However, this may not be enough, and the child may need hospitalization and IV fluids. It is important to control the fever and lower the temperature by using paracetamol. Follow the instructions to make sure the correct dose is given for the age of the child. You also may need to remove clothing and use a fan to help cool the child down. Nutritious food is essential to restore health, particularly foods rich in iron and folic acid are important in order to treat the anemia that has occurred. An important part of preventing malaria in children is to look after the pregnant woman and keep her healthy so the child is born healthy. Encouraging the mother to breastfeed helps, as this would pass on some of her malaria immunity, if she has it, to the child. Ensuring that children get a healthy diet is very important, and making sure that they have food from all the food groups help them have a good immune system and resist disease. You can see some of the food groups in this slide, but for more information on nutrition and its effect on malaria, be sure to review Chapter 7. And it is also important to make sure children sleep under LLIN mosquito nets and use insect repellents. Malaria affects the physical and intellectual development of children and harms their education and future prospects. And for our children's sake, let's put our effort into preventing, diagnosing, and treating malaria as quickly as possible. As mentioned earlier, children, and particularly those under 5, are very vulnerable to malaria. By recognizing the signs and symptoms of malaria in children, we can help save lives. So, thank you for watching and learning about how you can help save children from the effects of malaria. Bye for now.